Thanks a lot for being here. It's a real pleasure. I will, in my 15 minutes, as soon as the slides come on, here we go. I'm going to just tell you first very briefly about the reason I'm interested in parenting and parent engagement and what has motivated my work. Yes, sorry. What has motivated my work in this area. And I'll tell you a little bit about my own views of the state of knowledge about parenting interventions at the present time and my own view of what we know and what we still need to know. And then I will conclude by telling you a little bit about my new work that takes, I think, a somewhat different approach to engaging parents in programs designed to help them realize their own aspirations for helping their kids develop their full potential. So very quickly, and I'm sorry if this is all repetitive to everybody in the room, but just briefly, it is evident from lots and lots of descriptive studies in developmental psychology and other fields that gaps in children's cognitive and emotional and social well-being open up very early in life. These are data from Jane Waldfogel and colleagues from large nationally representative data sources showing large income-based gaps in both cognitive and non-cognitive skills among children. These are observed among children at age 4 years. You can go to other data and see these gaps opening up really as early as we can reliably measure them. These gaps close very little over the course of children's schooling years. This is a slide I borrowed from Jim Heckman, showing really that these are education-based gaps in children's cognitive skills are largely the same from, again, early childhood all the way to the end of the school years. Now, these two slides should show us two things. One, that given, I'm sorry, what am I doing wrong here? Something? Okay. Given that these gaps open up long before children get to formal schooling, that should point us in the direction of understanding that what parents do is important. Given that these gaps close very little, if at all, over the course of the schooling years, that should tell us again that schools alone are not going to be effective if we can't help parents support their kids' development. And finally, just, is this working? I'm sorry. Am I offline here? There we go. Just to conclude this introductory piece, the gaps between low and high income children in their achievements and attainment appear to be growing over time. This is borrowed from a slide from a paper that I've actually written with Greg, and should just inspire us to understand that this is a persistent question of scientific and policy relevant interest, understanding the role of family background in producing children's attainments and achievement. Now, again, I've spent a lot of time thinking about children's home environments and a lot of time documenting income or education-based inequalities in children's opportunities at home. And this kind of stylized slide, again, just summarizes dozens and dozens of studies showing the vastly different opportunities children have for supportive parenting in their home environments. And we know that these dimensions of parenting, that what parents do, are important components of those income-based gaps in children's development. So it's not the case that the income-based gaps in children's cognitive or non-cognitive skills arise exclusively from differences in parent income. In fact, again, drawing on Jane Waldfogel's work, using the ECLS-K, the single greatest factor that explained those income-based gaps in children's outcome were measures of parent behavior, and not, in fact, income itself. So these measures of parenting, including maternal sensitivity and responsiveness, explain very large shares of the income-based gaps in children's skills very early in life. Similarly, measures of the home learning environment, in particular cognitive stimulation, are paramount in understanding these SES-based gaps in kids' achievement. Okay, so that was just the preamble. I think I'm preaching to the choir here. You don't need to be convinced of the importance of understanding this question and of the potential role of, not the potential, but the actual role of parents in explaining differences across families in children's development. Now, we have a lot of programs that are designed to help close these gaps between advantaged and disadvantaged parents in the opportunities they're able to provide for their children, especially in the home environment. This, as you know, is a tall order. There's many challenges to designing and implementing these kinds of programs. I've listed a few of them here. As I say, I think many of them are quite obvious to everyone in the room, especially the practitioners who are here, who have long thought about these problems, long before academic researchers started trying to tackle them. I'm especially concerned about number 4, which I've highlighted here, which is the question of attrition and low take-up in many different parent support or parent training interventions. I think if you take a careful look at the large-scale parenting interventions that have been evaluated in experimental contexts, you will agree that the impacts are modest. And I think you will agree that they are especially modest relative to their cost. And although we can't directly link a problem of low attrition and take-up to those modest impacts, I think it's a leading candidate for why we aren't getting a bigger bang for our buck in these kinds of programs like Nurse-Family Partnership, Early Head Start, and others. These are the ones with which I'm most familiar. I'm sure there are many more that experts on the panel might be able to say the same thing about. And I've spent a lot of time thinking about why this is so. And here I'm going to spend the next couple slides just giving you some of my thoughts on this problem of attrition and take-up. It is now my opinion that much of what we think about when we think about designing a parenting intervention is to say, what do children need to develop into happy, healthy, successful adults? And we devise a menu of all the inputs that we think children need to achieve those benchmarks, okay? And developmental psychologists and pediatricians get together in a room and we've got 10 things we think children need. I think we much less often start with the question, what would it take to get parents to do the things that they're not already doing, that they themselves want to do, that they aspire to do, that they understand, that they're fully aware, they have all the information they need, as we just heard from the last panel, or enough of the information they need, and yet they're not doing what they say they want to do. So I think this is a kind of first-order problem in the way we think about parenting interventions, is really thinking about it from a behavior change perspective vis-a-vis a child development perspective. Secondly, and this is a related but different point, I think in developmental psychology, my own field, we tend to think a lot about parenting as a style. And we think we'd like to change parents from being style A to style B. I personally think this is a non-starter in the world of interventions. This is just impossible. We need to think about parenting as a series of discrete decisions. We need to think about what is the thing we would like this parent to do that he or she is not already doing. Not try to change 20 things at once to make parents into different kinds of people. And we see this, again, just in the academic literature, the very way we say parenting. I don't actually even know what that means, parenting. I want to say parent behavior, parent decision making. And I've actually tried in the last year to start using that language as a way to frame my own thoughts in this field. So I've kind of already said that. We've had a mixed track record of success in a lot of our most well-known, most famous interventions. Even Nurse-Family Partnership, which is a program I admire very much, has been successful at changing the things it was developed to change, which is actually to reduce parent abuse and neglect. It has not been nearly as successful as at changing the quality of the home environment, which it was not designed primarily to do, and so that's fine. But I'm a little worried that now we talk about Nurse-Family Partnership as if it was sort of the Uber program that is going to change the home environment for low-income kids, and I just do not think that's the case. So here's a slide. This is from Nurse-Family Partnership, just illustrating to you this problem of dropout. Okay, very good. Dropout and attrition. These are data from the National Office of Nurse-Family Partnership, 20,000 data points here, just showing the rate, the very high rate of dropout of mothers in the program. So a large share who is enrolled drops out really before they even get started. They drop out early and often, and by the time we get to the end of the program, where we would hope to see, something in, close to, ideally we'd like to see 100% of the mothers, you can see we're well short of that benchmark. Okay, so to be quick, I'm going to try to wrap it up in the 5 minutes I have left. As I said, it would be terrible to give the impression in the policy world that that we're spending a lot of money and getting very little in return. And what I would rather do is to say we have another problem to solve, we have another challenge to address here, and that really is this question of behavior change. And really when I say that, I mean fundamentally about instilling habits in families that are not present, that are not already present. So something as simple as that, not changing a whole set of beliefs and values and styles, as I say, but simply shifting from not doing X to doing X regularly and persistently. I'm going to just say this and then I'm going to skip a few slides because I think I have too many. Let me just say that I'm a big believer in the idea that this information model is also a non-starter. Information alone does not change behavior. I think it seems like we have a lot of agreement in the room on that point. I also think we don't have a complete understanding, actually, of who parents listen to when it comes to behavior change or when it comes to absorbing information. It's not evident to me from my reading of the academic literature that parents listen to experts for parenting advice. I think we really need to think about that, as I know you all do in thinking about this program delivery model. So I'm going to skip over a couple slides and just tell you very briefly the results in my remaining 3 minutes of a new field experiment that I've just concluded, whose goal, this is work in my lab, a study called the Parents and Children Together study. The goal is really to do a proof of concept in an experimental context to see if we can draw on tools from behavioral science that have been shown to support behavior change in other contexts, financial savings behavior, smoking cessation, weight loss, and other realms of behavior, to see what kind of success we would have if we brought those tools into the world of parent behavior change. So this is a field experiment I recently finished in Chicago with about 150 parents, mostly mothers, in Head Start centers across the city. And it was designed very simply to see, could we change the amount of time that parents spend reading with their kids using only these tools drawn from behavioral science? Mechanically, what we did was lend parents a digital tablet for 6 weeks. It had a recordable library on it with a recordable book reading app, so we could objectively measure the amount of time that parents were reading to their kids using this particular modality. And we randomly assigned these 150 parents to treatment and control. The treatment group got a kind of kitchen sink of these suite of behavioral tools designed to change behavior, including number one, goal setting. So every week parents set goals for the amount of time they wanted to spend using this app to read with their kids. They got daily text message reminders reminding them of their goal. At the end of each week, they got visual feedback showing them how much time they actually did spend reading vis-a-vis the goals that they set. And every week they got social recognition for either meeting their goal or for having the highest level of reading among other parents in the Head Start Center. And really all that was the screen lit up and a dancing bear danced across the screen and it said you won or you met your goal. So this is super simple, it's super easy to implement, and it's practically free. And that's the point. And what did we find? Here you go. The intervention lasted 6 weeks, as I said. Here is the total amount of reading between treatment and controls at the end of that 6-week period. You should ignore the levels, because if you think about the math for a little bit, this is not dramatically high amount of reading. It's only reading using one particular modality. It doesn't capture all the reading that parents might be doing with their kids. But what you should really pay attention to here is the treatment impact. which is by any measure enormous. It's a standard deviation difference between treatment and control in the number of minutes that parents in the treatment group spent reading relative to those in the control. The big question here is not can we, nudge people every single day to do the thing we would like them to do, but whether we've actually formed a habit. The big question in any of this kind of work is what happens when the program goes away. We've tried to answer that. We have 2 short-term follow-ups where we took away the treatment. In the immediate follow-up, we did a 3-week post-treatment assessment, and the effect largely did not diminish. Okay, so we have a statistically significant difference still 3 weeks out. 3 months out, we went back to the treatment and controls and gave them the tablets again for another 3 weeks. We get a pretty large difference. It's no longer statistically significant, but we have pretty tiny samples because it's pretty hard to find these families. So that's it. That's all I wanted to tell you. This is just a high-level overview of what I'm doing, and I'm obviously happy to provide more detailed information to anybody who wants it.